Welcome to my video on CKD or chronic kidney disease. Always consult your doctor or health care professional before making any changes to your medication. Most people don't have symptoms of chronic kidney disease until it's at an advanced stage. This summary is based on my experience and what happened to me. I got an angina attack or heart attack in 1993. It resulted in having to do a triple bypass and loss of my job at Shell Petroleum Refinery as an engineer. Heart disease is also a side effect of uncontrolled diabetes in almost all cases. Currently I have mild or stage 1 kidney disease and hope to get better with the current treatments and mostly plant-based diet. If you have uncontrolled or moderately managed diabetes, unfortunately you will likely come across CKD or chronic kidney disease sooner or later. As I remember, I had a fairly good control of diabetes with A1c about 8 before, but used to eat chicken regularly. US Food and Drug Administration, FDA, has approved Jardiance, empagliflozin 10 mg tablets to reduce the risk of sustained decline in estimated glomerular filtration rate, eGFR, end-stage kidney disease, cardiovascular death and hospitalization in adults with chronic kidney disease. Most people don't have symptoms of chronic kidney disease until it's at an advanced stage. Advancing the fight against chronic kidney disease, novel therapies and research breakthroughs. Blood pressure reducing drugs like ramipril or tritase have shown promise in reducing the risk of kidney disease. I am in a way lucky I was prescribed that in 1993 by my then cardiologist. Sodium glucose cotransporter 2, SGLT2, inhibitors, initially developed for diabetes management, have shown promise in treating CKD. They include drugs like these drugs not only help control blood sugar levels but also exhibit renal protective effects. Recent clinical trials have demonstrated that SGLT2 inhibitors can significantly reduce the risk of CKD progression and cardiovascular events in individuals with diabetes and CKD. This includes medications like Brenzavir, bexigliflozin, Invokana, canagliflozin, Farxiga, dapagliflozin, Jardiance, empagliflozin, Steglotro, ertugliflozin. Chronic kidney disease, CKD, is a silent epidemic, affecting millions worldwide and gradually diminishing kidney function. While there are established treatments for managing CKD symptoms and slowing the progression, the search for curative therapies remains ongoing. Fortunately, recent advancements in research are bringing new hope to CKD patients, with promising treatments and drugs emerging on the horizon. We are still in the middle of the video. Do not forget to hit the like button while watching this video. See the description and comments for reference. We would appreciate your comments in any language. Medicine targeting the renin-angiotensin-aldosterone system, RAS. The RAS plays a crucial role in regulating blood pressure and fluid balance. This is my view only. By eating a lot of protein, especially animal-based, may increase the workload for kidney, resulting in overload. Its overactivation in CKD can accelerate kidney damage. Angiotensin-converting enzyme inhibitors, ACEs, and angiotensin II receptor blockers, ARBs, have long been the mainstay of CKD treatment, effectively slowing kidney function decline and reducing cardiovascular risks. Recent research has explored the potential of dual RAS blockade, combining an ACE and an ARB to further enhance these benefits. Studies have shown that dual therapy can provide additional protection against kidney disease progression and cardiovascular events, particularly in patients with high-risk CKD. Emerging therapies for CKD complications. CKD is often accompanied by a host of complications, including anemia, bone mineral disease, and hyperkalemia. These complications can significantly impact patients' quality of life and overall health. Fortunately, new treatments are emerging to address these challenges. Anemia, a common complication of CKD, can cause fatigue and weakness. Erythropoietin-stimulating agents, ESAs, are commonly used to stimulate red blood cell production and alleviate anemia symptoms. However, ESAs can also increase the risk of cardiovascular events. Researchers are exploring novel therapies that target hypoxia-inducible factor, HIF, a protein that regulates oxygen levels in cells. HIF stabilizers could potentially stimulate red blood cell production without the cardiovascular risks associated with ESAs. Bone mineral disease, CKD patients often experience bone mineral loss, increasing their risk of fractures. Calcium and vitamin D supplements are essential for bone health, but in some cases, additional medications may be needed. Parathyroid hormone or PTH, which regulates calcium levels, becomes elevated in CKD. Cinacalcet, a PTH receptor antagonist, can effectively control PTH levels and reduce the risk of bone fractures. Hyperkalemia, a dangerous elevation of potassium levels in the blood, is a common complication of CKD. Traditional treatments for hyperkalemia, such as potassium binders and dietary restrictions, can be burdensome for patients. New potassium-binding agents, such as patiramir, offer improved binding capacity and can reduce the risk of hyperkalemia-related adverse events. The field of CKD research is rapidly evolving, with a growing emphasis on personalized medicine. Identifying genetic and molecular markers that predispose individuals to CKD and its complications could lead to targeted therapies tailored to specific patient profiles. Inflammation also plays a significant role in CKD progression. Researchers are investigating anti-inflammatory agents as potential treatments to mitigate kidney inflammation and slow down disease advancement. Some existing medications, originally developed for other inflammatory conditions, are being repurposed for CKD treatment. Clinical trials are evaluating their effectiveness in reducing inflammation and preserving kidney function. Researchers are also exploring the potential of gene therapy and stem cell therapy to regenerate damaged kidney tissue and restore kidney function. While these approaches are still in early stages of development, they hold promise for future CKD treatments. The fight against CKD is gaining momentum, with new research and clinical trials paving the way for more effective treatments and potential cures. As our understanding of CKD's underlying mechanisms deepens, we can expect to see a wider range of personalized and targeted therapies emerge, offering hope to millions of CKD patients worldwide. Do not forget to click the like button. Thanks very much for watching this video. Up above you see 2 videos related to health. It will be more helpful to you and your family. See you in the next video. What to do if you find something unusual happening after you start on a cholesterol medication. Common side effects. These common side effects of rosuvastatin happen in more than 1 in 100 people.